say they would get a vaccine if they were able to do so around their working hours. So we are very pleased that effective immediately, the American Hospital Association has launched the capability to bring vaccinations directly to people's workplaces through their member hospitals. Employers can now email COVID-19@aha.org, and your business will be connected with a local provider who can work with you to host an on-site pop-up clinic and usually make it happen in a matter of days. Many states and many businesses have launched incentive programs, and anecdotal reports are emerging that many of these are working well. Look at Jonathan Carlisle, an Amazon delivery driver from Toledo, Ohio. Here's what he said about getting vaccinated, and I quote, "I kept hemming and hawing about it, and I work all the time. When this Vaccination thing started, I immediately went down there and got it. It pushed me over the edge." Today, Jonathan Carlisle is on his way to being fully vaccinated. And he's a millionaire because he also won Ohio's Vaccination. Safe from COVID and a millionaire. And Jonathan, it doesn't stop there. You're also eligible for a free beer from Anheuser-Busch on July 4. What a great country. And that's before even considering that Dr. Fauci and his team at the National Institutes of Allergies and Infectious Diseases helped invent and invest in the mRNA platform over the last 2 decades so that we would be ready in case the worst should happen. Jonathan, that's how you got your vaccine in the first place. So thank you, Dr. Fauci. Finally, many Americans say they will get vaccinated if one thing happens. They have a chance to talk to their physician and get their questions answered. So call your physician if you want to know if you should get vaccinated. And if you don't have one, call a local hospital or clinic. Rather than wait for the call, the people at a company called Centene, an insurer that disproportionately serves lower income Americans, is initiating something highly innovative that I hope people follow, and so do they. They will launch a campaign to conduct vaccination education and outreach to 25 million Americans. More than half of them will get a call directly on their phone. And when Centene reaches someone who's unvaccinated, they will connect them to their physician directly and help them arrange an appointment. Kaiser Permanente is conducting a similar approach through email, texting, and direct mail. We do hope other organizations with broad reach directly into patient populations like this follow their lead and contact people who are at risk because they don't have a vaccination and talk to them about the benefits of vaccination. These are all great examples about how this is not an effort to 70% that is being done by the government. It is being led by the American people and by constituents all around the country. Since today is my last briefing and tomorrow is my last day in the White House, I want to close by saying what a pleasure it has been not only to serve on the president's COVID response team, but to be able to help lead these briefings. We've aimed to follow the example of the president by presenting clear, straight answers to the best of our ability in a view of what we are seeing, whether the news is good or bad. It has been an honor to serve as part of an administration committed to working day and night until Americans are able to feel safe again from this pandemic, that the pandemic becomes highly manageable, that the economy is flourishing, and that we are on our way towards vaccinating the globe. But I'm even prouder to serve an administration that has been so deeply committed to showing our values in action every day, pulling everyone together and leaving no one out, empathetic to what ordinary Americans are going through, and leading with equity at every turn. Even as so much of what we cherish is returning, we cannot let our progress be a reason for taking our foot off the pedal. Threats remain. We must push harder so more Americans can return to normal life and the peace of mind that comes with being vaccinated. And with that, I'll turn it over to Dr. Walensky.
Thank you, Andy. Please know you will be dearly missed in this venue and across. Good morning to everyone. I'm pleased to be back with you today. As far as the data, yesterday CDC reported just over 10,000 new cases of COVID-19. Our 7-day average is 13,277 cases per day, and this represents yet another decrease of nearly 30% from the prior 7-day average. But most importantly, a 94% decrease from COVID-19 cases since January of this year, and the first time that the 7-day average of cases has been less than 15,000 since March 27th, 2020. In other good news, the 7-day average of new hospital admissions is just a bit over 2,200. That is a decrease of 83% in hospitalizations since January 9th of this year, when we peaked at over 16,500 average daily admissions. And finally, the 7-day average of daily deaths remains at 379 per day. It gives me so much hope to report these declines in cases, hospitalizations, and deaths. It is in part a result of our ongoing efforts to vaccinate so many Americans. Each week, there are more and more data to demonstrate the impact of vaccination has on preventing disease and moving us out of this pandemic. Today, CDC published an MMWR that demonstrates how high vaccination coverage in older adults in the United States has served to reduce COVID-19 cases and severe outcomes. In this new CDC study, we looked at the rates of cases, emergency department visits, hospitalizations, and deaths across all age groups, both before and after the COVID-19 vaccine was available, from December 2020 to May 2021. We observed larger declines in COVID-19 cases, emergency department visits, hospitalizations, and deaths in adults over age 65 who were prioritized for vaccination in the early phases than in adults aged 18 to 49 who were less likely to be vaccinated. By comparing data from November and December of 2020 before vaccine rollout with data from April and May after vaccine rollout, and by stratifying the data by age groups, we were able to see the critical contribution of vaccination coverage on reducing COVID-19 cases, severe illness, and death, especially among those over age 65. As of today, we have administered over 300 million doses of COVID-19 vaccine. More than 85% of adults over age 65 have received at least one dose of a COVID-19 vaccine, and 75% are fully vaccinated and protected. Still, we have a lot more work to do, especially in younger age groups. Of Americans that qualify for a vaccine, those that are age 12 and over, we have been able to vaccinate 50% of the country. This is great news, but there is more work to be done. During this pivotal month of action, if you are not vaccinated, please go to vaccines.gov, text your zip code to GetVax or 438-829, or talk with your healthcare provider, state or local health department, or local pharmacist to find out more about getting vaccinated. And if you've gotten your first dose of Pfizer or Moderna, don't forget to get your second, either 3 or 4 weeks later. I'll stop here and turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. Before I start, let me just underscore what Dr. Walensky said about how much we will miss Andy Slavitt. Andy, you are a class act, and we will miss you greatly. What I'm going to do right now is spend the next couple of minutes talking to you about a subject that has gained a lot more attention over the last few days, and that has to do with the variants in general, but particularly in the variant which we now refer to as Delta, or the B1617.2, which in fact, as you know, originally was noticed in India and dominated in certain states in India, but now has spread throughout other elements and other areas of the world. Next slide. So let's just take a quick look at that. It's reported in 60 countries, including the UK and the USA. Clearly now its transmissibility appears to be greater than the wild type, namely the alpha variant. It may be associated with an increased disease severity, such as hospitalization risk, compared to alpha, and in lab tests associated with modest decreased neutralization by sera from previously infected and vaccinated individuals compared to the alpha. However, fortunately, 2 doses of the Pfizer vaccine and AstraZeneca appear to be effective against the Delta variant. There's reduced vaccine effectiveness after 1 dose, however, and I'll get back to that in a moment. Next slide. This is a publication from what I had mentioned to you at a previous briefing from Public Health England, and it has to do with the effectiveness of the COVID-19 vaccines against this Delta variant. Just to reiterate, 2 weeks after the 2nd dose of the mRNA Pfizer-BioNTech, it was 88% effective against the 617, and just like we've shown multiple times, over 93% effective against the B117. Take a look at the last bullet. 3 weeks after 1 dose, both vaccines, the AZ and the Pfizer-BioNTech, were only 33% effective against symptomatic disease from Delta. Clearly important about why a 2nd dose is so important. Next slide. Now, what about what's going on in the UK, and why should we learn lessons from this, and always getting back to the situation of why it's so important to be vaccinated? In the UK, the Delta variant is the rapidly emerging as the dominant variant, greater than 60%. It is replacing the B117. The peak transmission in my conversations with and the data associated with the UK, when talking to their health authorities, the transmission is peaking in the younger group of 12 to 20-year-olds. Namely, that group that we're concerned about here, about making sure they get vaccinated. And as I mentioned before, there's poor protection after a single dose of either the mRNA or AZ vaccine. Next slide. This slide graphically demonstrates in the darker part of the slide, the red, the emergence of the B16172 compared to the lighter pink, which was the original B117. It's essentially taking over. Last slide. So let's look at where we are in the United States. That variant, the Delta variant, currently accounts for more than 6% of the sequenced cases in the United States. This is a situation the way it was in England, where they had a B117 dominant and then the 617 took over. We cannot let that happen in the United States, which is such a powerful argument to underscore what Dr. Walensky said. To get vaccinated, particularly if you had your 1st dose, make sure you get that 2nd dose. And for those who have been not vaccinated yet, please get vaccinated. This is the National Month of Action. We want to get to and above the goal of 70% of the adult population receiving at least 1 dose by the 4th of July. I'll stop there and over to you, Dr. Nunes-Smith.
Great. Thank you so much, Dr. Fauci, and good morning to everyone. As we know, for our national vaccination campaign to be successful, everyone in our country needs to benefit from the scientific discovery with the vaccines. We absolutely cannot beat this virus without making sure there's a plan that works for everyone and works for all communities. So to ensure that we are truly reaching everyone who is unvaccinated in this phase of our vaccination program, in this month of action, we are working hard and continuing to make progress in addressing the structural barriers that many people face in terms of access. We're focusing even harder on meeting people exactly where they are. And we will continue to provide the public with the answers that you need about getting vaccinated. It is our pledge to make sure that vaccination is easy and convenient for everyone. So we've increased the number of pop-up and mobile units across the country. We've ensured that the majority of our 40,000 participating pharmacies are located in areas that are at higher risk. We understand not everyone can operate on a 9-to-5 schedule, as Andy said. So pharmacies are now accepting walk-in appointments and have extended their hours. Starting this week, thousands of pharmacies nationwide will stay open late every Friday in June and will offer the services throughout the night to make sure individuals can get their shot. We already see the difference our pharmacy program is making to close the equity gap. Over the last 2 weeks, half of pharmacy doses have been administered to people of color. And our community health center program remains another trustworthy, available option for neighborhoods across the country. They are also closing the equity gap. About 70% of shots through the federal community health center program have been administered to people of color. Still, when talking to those who are unvaccinated, I often hear many of the same reasons for why they have yet to get a shot. Many people have concerns about missing a day of work, about paying for childcare, or about how they will travel to and from a vaccination site. For individuals and communities facing greater degrees of socioeconomic disadvantage, those who can't afford to miss a day or two of work, and can't afford unplanned, unexpected childcare or travel expenses, risking a shockwave through a family's finances is just not tenable. So the COVID-19 response team has focused on addressing each of these barriers: paid time off, childcare, and transportation. First, last month, the president announced a tax credit to fully reimburse employers, those with fewer than 500 employees, that provide paid time off for vaccination and any side effects. And he called on every employer in the country to do the same. And second, last week, the president announced that through July 4th, the nation's largest childcare providers will offer free childcare to parents and caregivers getting vaccinated and anybody recuperating from vaccination. The Department of Health and Human Services also issued guidance encouraging all states to use funding from the American Rescue Plan to support local and home-based providers who want to join the effort. And third, Uber and Lyft providing free rides to vaccination sites through July 4th. And just today, the Department of Transportation announced that more than 350 transit agencies across the country are also offering free rides to vaccination sites. We want to give everyone in the country as many free transit options as possible by subway, bus, rideshare. There are multiple ways to get to and from your shot for free. And many of these public transit efforts are supported by the American Rescue